When a lot of patients send in information to me requesting information about a facelift, most of these patients are actually asking about facial rejuvenation. What do I mean by that? So let's say a patient sends in an information request about facelift. It's a wide category. Patients put that into the web lead consult form. When I actually see these patients in consultation in my office and ask them, what would you do if you had a magic wand? Most of these patients are going to say, well, I really want to get rid of my neck waddle. I want to sharpen my jawline. Oh, and by the way, maybe also some of the excess skin in my upper eyelid region. This is why I basically lump these types of patients into a category called facial rejuvenation. In the category of facial rejuvenation, that same patient, when they come into the office, I'm going to assess them. I'm going to take a look at all the different procedures that are going to achieve a harmonious balance in turning the clock back. That may include maybe doing an eyelid surgery, maybe doing some fat transfer. There's a whole host of ancillary procedures that can be done in order to completely rejuvenate the face. Once that assessment has been done, I'm basically going to give that patient a blueprint of all my recommendations, some recommendations that address only the patient's concerns, as well as groups of procedures that the patient may want to consider doing together. So now the patient has all the information they need to decide exactly where they want to go, whether they want to go with just a facelift, whether they want to do some of the ancillary procedures and get a more harmonious balance. The world's your oyster. You get to make all those decisions. However, the main important part of this is that initial assessment in order to figure out what it is that that patient needs. This is invaluable in assessing the blueprint for facial rejuvenation.